Hello there and welcome. Studying for the psychiatric nurse practitioner is not a joke. The PMHNP board certification, it is a hard exam, hardcore. Right now, it is your chance. I am going over few of the most high yield topics you need to know for your PMHNP board certification. My name is Dr. Lopez. Make sure you like it, subscribe it. I will always provide you free content. Now, if you want a little bit more, make sure to sign up to our PMHNP crash course review. See you on the other side when you are PMHNP board certified. Join us today. Nurse terminologies, right? We want to make sure that we know what the scope of practice is. When you hear scope, think of the state. What the state says you can and cannot do is the scope of the state. It defines what the NP rules and regulations, right? Actions. What can you do in Texas? What can you do in Florida? What can you do in California? Scope is the state. Confidentiality, right? Is the patient's right to expect confidentiality, but not privacy. Providers will provide the privacy, right? But confidentiality, it's a right. So what do I mean? Patient has the right to confidentiality, but not privacy. So confidentiality, I cannot talk about the patient's condition in the elevator. Privacy, I have a violent patient in the inpatient that I would like to provide privacy. However, is a violent patient, so I need to assess the patient with the open door for his safe, and my own safety. The benefit of releasing information outweighs the risk. You found someone on the ground, the person's passed out. Are you going to walk away or are you going to start treatment? Well, the person didn't give consent, right? The situation requires outweigh the risk of confidentiality there. Okay, so we talked about confidentiality a lot. So what is informed consent? Basically is when you tell the patient that what's going to happen for the course of treatment. You get informed consent before surgery, right? Now, hey, here's the informed consent. We are going to have a surgery on the left leg. This is for a complete knee replacement. Here are the treatments. This is what you're going to get for pain. These are the alternatives. You don't have to do the surgery. There are other means. However, they are not as robust for your condition, but you have choices. This is when you do informed consent. Legal principle in nursing, you will see them guarantee you, this is easy topic, guarantee you get a hard question. So you need to know this like you know your last name. Start with justice. Everybody knows justice doing what's fair. It's not fair, daddy. Justice, right? As an aspect in all things in patient care. Justice means fairness. Example. All the examples are important. Excluding someone from a medication trial because of their financial status, they cannot afford. I'm going to just say, hey, you're not going to be part of this treatment. I'm not going to offer you because you cannot afford. Autonomy. Another one that people get it wrong because you don't know if you're talking about your autonomy or autonomy of the patient. the right of self-governance, permitting the patient the authority to accept or reject life-sustaining treatment. Patient's right. Two things the patient have right, at least, really it's three, but I always think of two. Patient have rights to least restrictive environment, and patient has the right to confidentiality through their informed consent as well. Two, at least is high yield. Least restrictive environment, you do not put the patient on inpatient because if the treatment can be done outpatient, right to confidentiality. And then we add informed consent. Hey, 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 this is Dr. Lopez here. My name is Dr. Lopez. I'll help you pass the PMHNP board certification. If you liked this content, what if you could have everything at your fingertip? Unlimited classes, recorded classes, question bank, diagnostic tests, student WhatsApp support. Who else does this? Nobody. My name is Dr. Lopez, and I teach at NP Exam Coach your way to become a PMHNP board certified today. Join us.